I'd like to welcome you to our office. When you come to Quantum Vitality, when you first get to the office, you're going to be greeted, a warm greeting. And you'll see our hospitality center where we've got water, we've got tea, coffee, and mints, just to kind of make you feel at home. Because when you come to our office, we understand going to a doctor, it's stressful. It's a new environment, and we want to help you relax. When you come into our facility, we've got to figure out, number one, what's wrong? And then, more importantly, will we be able to help you? And if we don't think we can, we're going to refer you to whatever type of practitioner we think might be best for you. So after you settle in at our office, we're going to take your case history. You'll either fill out your history in our electronic health records, or computerized in the office, and some patients prefer to download our forms off of the internet and complete them on the computer and bring them with them. Whichever you prefer is fine. But we're going to get a good detailed history. And we're going to remind you, if you need glasses, bring them with you. Also, if you need moral support, if you have a family member or loved one that you would like to have with you, please bring them. They're welcome to join us. We always recommend, before you get here, either type up or just hand scribble, review your history, all the important things that you want to make sure that you tell us. If you do that in advance, you're going to remember much more than just trying to recall when you're sitting here with us. So do that in advance, you'll find it helpful. We're also going to remind you, bring any pertinent medical records, MRI reports, surgical reports, blood work, anything that you think is pertinent to your current health situation, bring that with you. After our consultation, we're going to do a preliminary screening exam. We do that no charge. We never charge for that because we want to find out if we want to rule you in or rule you out as a potential chiropractic patient in our office. And when we do those preliminary screening exams, we're looking to correlate your health history with the neurology. We're going to check your range of motion, tender spots, and we're going to see if we can put the whole picture together to determine whether or not you're in the right office. If it's good news, we know we can accept you as a patient, or we believe we can if those factors all correlate. Now, most often, once we get through the preliminary screening exam, some additional diagnostic testing is indicated. More often than not, spinal x-rays are what we recommend. And if they are needed in your case, you can have them done here at Quantum Vitality, or if you prefer, you can have them done elsewhere. But we have our own x-ray unit, true digital x-ray, available on site. If you're in severe pain, if emergency treatment's needed, we can get that done right on the spot. But after we take x-rays, generally we will then schedule you for your next visit for a report of findings that gives us time to study the x-rays, to review your health history, to make sure we do a good job in preparing for your treatment. When you come back for the report of findings, we're going to review your history, our physical exam. We're going to discuss your treatments. We're going to put together an overall game plan, and we will begin your treatment plan. Now, if you have a chronic problem or a more complicated problem, after we take your x-rays, we may schedule you not for a full report of findings, but for another visit to complete some additional diagnostic work, functional diagnostic. Oxygen saturation, we do frequently. We may want to check your adrenal gland function. That affects so many things with your health. Your pH. We're going to test if you have heavy metal toxicity. Those are a few of the things we do additionally on that extended diagnostic visit. And we also like to see how you responded to your first treatment visit. And we take all of that information and we put it together and formulate a game plan. The next visit, we will sit down with all of that information and develop a final recommendation to discuss treatment plans, to handle finances, to handle any questions that maybe have come up. Once we come to an agreement on how we're going to approach, then we'll schedule you, we'll get your treatment plan right up to your first re-exam, and we'll get started with helping you regain your health.